Schizophrenia is a debilitating and complex disease. One of the current hypotheses is that schizophrenia is linked to dysregulation of presynaptic dopamine release. Interventional strategies for schizophrenia focus on blocking postsynaptic dopamine D2 receptors to reduce dopamine transmission. Dopamine release, however, can also be influenced by other neurotransmitter circuits in the brain. Muscarinic acetylcholine receptors belong to the acetylcholine neurotransmitter family, which can modulate dopamine release. These circuits might provide a unique opportunity to use the brain's own regulation system to fine-tune dopamine release in areas of the brain associated with the pathophysiology of schizophrenia. Neurons located in these areas express high levels of muscarinic acetylcholine M1 and M4 receptors, which, when activated, may modulate presynaptic dopamine release. This has made M1 and M4 receptors promising targets in schizophrenia research, especially considering that these receptors are not highly expressed in regions of the brain that control motor function and hormone regulation. COBENFY is a first-in-class treatment for adults living with schizophrenia. COBENFY is a combination of xanomeline and trospium chloride. Although the mechanism of action of xanomeline in the treatment of schizophrenia remains unclear, its efficacy is thought to be due to its agonist activity at M1 and M4 receptors in the brain. Xanomeline activates M1 and M4 receptors in brain regions thought to be associated with the symptoms of schizophrenia. This action may modulate presynaptic dopamine release, which can potentially help improve the symptoms of schizophrenia. Trospium chloride antagonizes muscarinic receptors primarily in peripheral tissues. COBENFY is a first-in-class treatment with the potential to help many adults living with schizophrenia. Indication: COBENFY, xanomeline and trospium chloride is indicated for the treatment of schizophrenia in adults. Important safety information. Contraindications: COBENFY is contraindicated in patients with urinary retention, moderate Child-Pugh Class B or severe Child-Pugh Class C hepatic impairment, gastric retention, history of hypersensitivity to COBENFY or trospium chloride. Angioedema has been reported with COBENFY and trospium chloride. Untreated narrow-angle glaucoma. Warnings and precautions. Risk of urinary retention. COBENFY can cause urinary retention. Geriatric patients and patients with clinically significant bladder outlet obstruction and incomplete bladder emptying, for example, patients with benign prostatic hyperplasia, BPH, diabetic cystopathy, may be at increased risk of urinary retention. COBENFY is contraindicated in patients with pre-existing urinary retention and is not recommended in patients with moderate or severe renal impairment. In patients taking COBENFY, monitor for symptoms of urinary retention, including urinary hesitancy, weak stream, incomplete bladder emptying, and dysuria. Instruct patients to be aware of the risk and promptly report symptoms of urinary retention to their healthcare provider. Urinary retention is a known risk factor for urinary tract infections. In patients with symptoms of urinary retention, consider reducing the dose of COBENFY, discontinuing COBENFY, or referring patients for urologic evaluation as clinically indicated. Risk of use in patients with hepatic impairment. Patients with hepatic impairment have higher systemic exposures of xanomeline, a component of COBENFY, compared to patients with normal hepatic function, which may result in increased incidence of COBENFY-related adverse reactions. COBENFY is contraindicated in patients with moderate or severe hepatic impairment. COBENFY is not recommended in patients with mild hepatic impairment. Assess liver enzymes prior to initiating COBENFY and as clinically indicated during treatment. Risk of use in patients with biliary disease. In clinical studies with COBENFY, transient increases in liver enzymes with rapid decline occurred, consistent with transient biliary obstruction due to biliary contraction and possible gallstone passage. COBENFY is not recommended for patients with active biliary disease, such as symptomatic gallstones. Assess liver enzymes and bilirubin prior to initiating COBENFY and as clinically indicated during treatment. The occurrence of symptoms such as dyspepsia, nausea, vomiting, or upper abdominal pain should prompt assessment for gallbladder disorders, biliary disorders, and pancreatitis as clinically indicated. Discontinue COBENFY in the presence of signs or symptoms of substantial liver injury, such as jaundice, pruritus, or alanine aminotransferase levels more than 5 times the upper limit of normal or 5 times baseline values. Decreased gastrointestinal motility. COBENFY contains trospium chloride. Trospium chloride, like other antimuscarinic agents, may decrease gastrointestinal motility. Administer COBENFY with caution in patients with gastrointestinal obstructive disorders because of the risk of gastric retention. Use COBENFY with caution in patients with conditions such as ulcerative colitis, intestinal atony, and myasthenia gravis. Risk of angioedema. Angioedema of the face, lips, tongue, and/or larynx has been reported with COBENFY and trospium chloride, a component of COBENFY. In one case, angioedema occurred after the first dose of trospium chloride. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, discontinue COBENFY and initiate appropriate therapy and/or measures necessary to ensure a patent airway. COBENFY is contraindicated in patients with a history of hypersensitivity to trospium chloride. Risk of use in patients with narrow-angle glaucoma. Pupillary dilation may occur due to the anticholinergic effects of COBENFY. This may trigger an acute angle closure attack in patients with anatomically narrow angles. In patients known to have anatomically narrow angles, COBENFY should only be used if the potential benefits outweigh the risks and with careful monitoring. Increases in heart rate. COBENFY can increase heart rate. Assess heart rate at baseline and as clinically indicated during treatment with COBENFY. Anticholinergic adverse reactions in patients with renal impairment. Trospium chloride, a component of COBENFY, is substantially excreted by the kidney. COBENFY is not recommended in patients with moderate or severe renal impairment. Estimated glomerular filtration rate, eGFR, less than 60 milliliters per minute. Systemic exposure of trospium chloride is higher in patients with moderate and severe renal impairment. Therefore, anticholinergic adverse reactions, including dry mouth, constipation, dyspepsia, urinary tract infection, and urinary retention, are expected to be greater in patients with moderate and severe renal impairment. Central nervous system effects. Trospium chloride, a component of COBENFY, is associated with anticholinergic central nervous system (CNS) effects. A variety of CNS anticholinergic effects have been reported with trospium chloride, including dizziness, confusion, hallucinations, and somnolence. Monitor patients for signs of anticholinergic CNS effects, particularly after beginning treatment or increasing the dose. Advise patients not to drive or operate heavy machinery until they know how COBENFY affects them. If a patient experiences anticholinergic CNS effects, consider dose reduction or drug discontinuation. Most common adverse reactions, greater than or equal to 5% and at least twice placebo. Nausea, dyspepsia, constipation, vomiting, hypertension, abdominal pain, diarrhea, tachycardia, dizziness, and gastroesophageal reflux disease. Use in specific populations. Moderate or severe renal impairment, not recommended. Mild hepatic impairment, not recommended. Pregnancy and lactation. There is a pregnancy exposure registry that monitors outcomes in women exposed to psychiatric medications, including COBENFY, during pregnancy. Healthcare providers are encouraged to advise patients to register by calling 1-866-961-2388 or visiting https://womensmentalhealth.org/research/pregnancy registry/atypical antipsychotics/. There are no available data on COBENFY use in pregnant women to evaluate for a drug-associated risk of major birth defects, miscarriage, or other adverse maternal or fetal outcomes. Additionally, there are no data on the presence of xanomeline or trospium in human milk, the effects of the breastfed infant, or the effects on milk production. However, xanomeline and trospium are present in animal milk, suggesting they may also be present in human milk. The developmental and health benefits of breastfeeding should be considered, along with the mother's clinical need for COBENFY and any potential adverse effects on the breastfed infant from COBENFY or the underlying maternal condition. COBENFY, xanomeline, and trospium chloride is available in 50 mg over 20 mg, 100 mg over 20 mg, and 125 mg over 30 mg capsules. Please see U.S. full prescribing information, including patient information, at www.cobenfyhcp.com.